I was out shopping and rehabilitating my back and hips when I got a call from my primary care physician, letting me know that I had something, it was all a blur, carcinoma. My name is Stacie Haynes-Roberts, and I received my care here at MedStar Georgetown University Hospital. My breast cancer journey started many years ago with my mother. She was diagnosed with breast cancer when she was 37 and died from breast cancer when she was 39. That was my introduction to breast cancer. Before I came to MedStar Georgetown, the treatment options that were presented to me were not ones that I liked at all. In fact, they were pretty depressing, but what was available to me once I came to MedStar Georgetown, to me, it felt like it was night and day. The ways in which Dr. Dela Cruz and Dr. Song and eventually Dr. Maynard, the way that they spoke with me, the way their team spoke with me, there was a recognition there of my humanity. There was a recognition there of my choices and preferences. And there were deep skills there, which I really appreciated. I ultimately had a nipple-sparing bilateral mastectomy that both Dr. Dela Cruz and Dr. Song performed. And once I recovered from that surgery, I began the oncological portion of my cancer journey with Dr. Maynard.
One of the things that we've been able to do in the last 3 years here is reconnecting the nerve. So the breast itself has multiple nerves that innervate the sensation of the skin. There's a lateral branch, there are medial branches, and then there is the branch that innervates directly to the nipple. That branch, we have to unfortunately cut it when we're doing a mastectomy. And so we are able to identify that nerve before we cut it. We cut it at the level of the exert, like when it comes out through of the muscle, and then we reconnect it with a nerve graft into the area behind the nipple. And we've been doing this for about 3 years now, and we've had a great success with patients after mastectomy having regained sensation.
I'm doing well, I'm cancer-free. I am continuing to undergo oncological treatment.
Stacie's outlook is excellent. She should be able to live a normal life and do all of the activities that she did prior to diagnosis and really fully enjoy life.
It's really important for women to do their own screening, especially at a young age, because I think we are benefited by taking our own healthcare into our hands. Especially for Black women, we tend to get hit with aggressive forms of breast cancer at very young ages. In fact, when I learned that fact and thought back to my mother's experience, she fit into that category. So I think it's really important for women to get to know their bodies in their teenage years, so they understand what their steady state is, what their norm is, so that they can notice differences, so that they can have educated conversations with their doctors, so that they can advocate for themselves with respect to mammograms, whatever kind of testing may be necessary for them. I think it's important for all women, and specifically for Black women, because of the particular kinds of cancer that we tend to have to deal with at young ages. And I'm not sure that that's something that most of us are aware of.
It's important for patients with a family history of breast cancer to be proactive about their screening, because they may be at increased risk for the development of breast cancer. So it's important to talk to your physicians about your risk and then have the appropriate screening, so that if the cancer is going to form, it would be caught early when the chances of cure are very high.
People can be friendly in any environment. These folks are folks who feel to me like they are invested in my well-being. And are you going to get that everywhere? No, but frankly, I think every person dealing with breast cancer, every person who has a family member who's dealing with breast cancer should have that as an expectation for their care.